I'm Brianne, and I'll be talking about COPD, which is chronic obstructive pulmonary disease, and the associations towards behavior of smoking. This involves risk factors, cultural, and any other associated disparities that might relate to why someone would choose to smoke, which we'll talk about later. So the first slide that I'd like to talk about is the goals and objectives. The goals and objectives are centered around the trans theoretical model, the stages of change approach. This outlines the 5 C's that Arizona State Department of Health has initiated into their plan, and this includes community, commitment, collaboration, coordination, and comprehensive. This was a great picture to outline the stages and all the different involvements that come with health communication plans and messages, and how they can be effective when we do them in the correct order and have the correct different stages, I guess, within development. So the next slide will be the communication goal. This has to do with primary audience as well as secondary audience. The first primary audience has to do with individuals that are diagnosed with COPD and individuals that are high risk. That involves anybody that might be a former smoker, a current smoker, as well as people that are immunocompromised or have prior health complications. The secondary audience has 3 different groups. There's the local and national organizations. You have the American Lung Association, the Arizona Smoke-Free Living, and you have the ASHLine, which is an organization that provides resources and information through the phone line, as well as your Arizona State Department of Health and your Maricopa County Department of Health. The last audience has to do with medical experts. This is psychologists or physicians. So the goal is to increase smoking programs, which include cessation, as well as rehabilitation programs, successes by 30% while reducing COPD prevalences by 15% in Phoenix by 2026. The last thing I'd like to mention on this slide is this little image off to your right. It has to do with stakeholder engagement and education, which we'll talk about later on. This has to do with multiple steps to be able to have a effective health communication plan, as well as a message that is tailored and meaningful to your target audience. This includes problem identification, analysis of the problem, your strategy and development, policy enforcement, policy implementation, as well as evaluation of all this and the overall result of your implementation to see what changes need to be done. Hi, so the next communication goal is for my additional audience. This has to do with e-cigarettes and cigarette use, as well as illicit drugs. This targets high school and middle school students, and the goal is to decrease the number of youth who smoke and first-time triers by 30% and reduce the long-term complications of COPD in Phoenix by 2026. So there's 4 different communication process objectives for my primary and secondary audience. The first one has to do with promoting information on reasons for quitting, as well as the associated health complications like COPD, and information on local programs and where they're located and how you can get access to them. This is done through questionnaires, and the analysis will be done through correlation of behaviors and our delivery method will be through email lists and mail to reach our audiences. By this goal, we hope to have 35% of Phoenix residents complete the questionnaire and provide associated risks to then tailor their interventions if they feel they would like to participate or engage in one of these programs that will be offered. And this will improve the rates of the pre-completion stage, and this will be done by December 1st, 2024. By June 1st, 2025, we would like an understanding of community needs, and this includes 5 local clinics around Phoenix will be provided, and workshops will be available for engagement and interest, and to learn about different associated risks and disparities that exist and why somebody might smoke. This will be done by having trained psychologists and physicians work together to help provide tailored aid for various stages of change. Within the workshops, they will be able to understand where an individual's at and where they'd like to be through provided information about the associated risks of smoking. Program development will include 2 peer support groups and educational courses to improve literacy and empathy among why they might be smoking. This will be done by June 1st, 2025. In October 2025, we hope to have an additional 100 individuals who are smoking or are at risk for smoking to seek help through counseling and request to participate in these tailored smoking cessation programs. This will improve the rates of the completion stage, which is the next stage in your stage of change model. By December 31st, 2026, we hope to have 1/4 of individuals out of the total population of Phoenix to be enrolled in a newly personalized development program or rehabilitation program, and 10% will demonstrate success in reaching the maintenance stage. That shows self-efficacy and the ability to quit and not relapse. This will then decrease the deaths from COPD in former smokers, and they will be able to reach the termination stage and have healthier living. Those are all different stages within the stages of change that we will be using. The communication outcome objectives for my primary and secondary audience are short-term, intermediate, and long-term. The short terms include by December 1st, 2024, 1/5 of the population 15 years or older in Phoenix will report they're aware of the associated risk of smoking. 30% of smokers in Phoenix can then locate the nearest support group offering behavior smoking cessation programs and rehabilitation programs, and can answer from improved literacy how to enroll in a program if they'd like. The intermediate goals are then done by June 30th, 2025. This is to expand insurance and medical health coverage to include 75 to 100% coverage of costs for these smoking programs regarding any social economic determinant that may exist. The next goal is to increase literacy on support and aid regarding healthier alternative options for smoking. The long-term goals are then reached hopefully by December 31st, 2026, and this increases the percentage of the individuals who have stopped smoking and have taken on a new habit that improves their lung health, as well as increasing the percentage of individuals who have reached termination and demonstrated no signs of relapse or need to use of cigarettes because they've taken on a new behavioral health habit. And the last one is to decrease the number of mortalities from smoking and reduce the number of prevalences of COPD cases and deaths that may exist within Phoenix. So the communication process objectives for my youth audience is to promote knowledge on nicotine through storytelling and visual representation in the form of video aid and ads within social media platforms. By 2025 of June, we'd like to provide educational workshops with counseling services as after-school programs in school corporations in Phoenix. This involves local psychologists collaboration with them to promote tobacco-free environments and provide tailored methods for healthier habits. Then by October 2025, we'd like to improve school policies for healthier environments, place paper infographics on the benefits of tobacco use, the benefits of prevention of tobacco, and offer after-school programs for enforcement of free drug environments, as well as tracking how many students might acknowledge the fact of doing those ads because they're non-skippable approaches through the social media ads. And the last objective by 2026 is to have 75 students have attended the after-school program, and 50 will have spoken with a counselor or psychologist about personalized risks and how to overcome them and learn how to have healthier living lifestyles, as well as showing interest in participating in one of these programs. The outcome objectives for my youth audience would be short-term. By December 31st, 2024, we'd like 60% of the students within the Phoenix School District to have acknowledged the risks for watching storytelling and visuals. Intermediate would then include at June 30th, 2025, to increase the number of students who have attended counseling and the availability of times to meet students' needs, as well as increase the number of after-school programs that offer educational workshops in the Phoenix School Corporation. The next intermediate goal would be then by December 31st, 2026, which is about a year and a half, to increase the number of students who have reported they have stopped smoking and have taken up new habits, and decrease the number of health complications in adolescents or youth. The last long-term goal that I would like to reach by December 31st by 2026 is to improve the health coverage among health insurance plans for mental health services like counseling and school environments, to understand triggers and habits and provide healthier coping lifestyles. On to the key messages. So for my audiences, my primary and secondary, studies display there is a correlation between smoking and COPD. Learning how to successfully stop smoking and preventing behaviors through personalized risk plans can improve health and lower risks of death. My key message for my audience, youth, would be then the exposure to nicotine, cigarettes, and e-cigarettes is addicting and can cause long-term respiratory complications like COPD that harm the quality of health and shorten lifespans. For my audiences, primary, which is individuals diagnosed with COPD, or high-risk individuals, would include persuasion. This is to educate and increase and strengthen literacy, as well as self-action plans. This would be done through behavioral counseling, smoking cessation programs. There's 4 different interventions that we will do. Basically, you have the theory-based intervention, which includes health belief, social cognitive theory, trans-theoretical, which we're talking about right now, as well as ecological. But the 3 behavioral health, trans-theoretical approaches that associate to this issue that I selected is the timing theory, which works to understand a personal stage, where somebody's at. Then you have cognitive behavioral health theory, which is the personal thought and behavior from determinants that exist. And then you have the 5A nursing model, which is an individual assessment, regular follow-ups, and setting goals. These will be done through face-to-face interaction if the person preferred that option. Then through the interactions, we would then provide printed material on information and statistics on smoking and COPD risks, as well as completing or doing virtual support meetings and workshops. This is to understand behaviors and reasons for smoking, as well as reaching audiences that may not be able to attend in person. So the next audiences is your psychologists, physicians, your organizations, and this would include engagement. We want to build strong relationships with patients and expert relationship and expand insurance policies. The organizational group around smoking and COPD connection is where they would have to focus their attention on. Their goals or their objectives is to outright the participation by monitoring media and leveraging social media public content that is appropriate for COPD risk individuals as well as people that may smoke. They should drive conversation to the public through workshops and webinars and increase literacy on the risks and reasons for change. They would then develop questions and answers from comments and replies through workshops and virtual meetings as well as social media networks. And they would provide scheduled social media and in-person events to provide engagement among the target audience. This is important to provide accurate, credible, and educational information to that target audience. Those are their roles within building a strong relationship between patient and expert. The communication channels would then include data collection and questionnaires to understand the risk of target audiences. This involves email and mail. You have then virtual work meetings, workshops, and webinars, as well as project websites. If you have multiple people working on this communication plan, they might not be able to get together, so it's possible to just put it all through a project website, and then they can put their insight in when is convenient for them, or do virtual meetings and webinars to discuss and collaborate. To reach or improve engagement, we would then do email and newsletters on timeline and visual aids for this program or this intervention that we hope to display to the public. And their overall goal is to create a location for team collaboration through the development of smoking and COPD risk associated messages. The next audience would be family and friends, and this is more towards informative. We'd like to educate and strengthen literacy to then provide beneficial support for an individual that may be going through this program. This can be done through newsletters, data such as facts and statistics on smoking and changes of health and why somebody may want to change their health style, as well as the risk of smoking or reasons for starting. You have workshops then that will be provided, and this will do the focus of advocating correctly and as well as an informatic tool for appropriate support, trust, and accountability. This is done to provide support that is beneficial as I mentioned. The goal is to inform, educate, and support to empower someone to change. Information to answer questions then comes through those workshops, and providing statistics or facts can help answer any questions somebody may have as to why someone may have started or may not be able to stop smoking, on top of the challenges of smoking, as I mentioned. The communication channel would include face-to-face interactions as well as counseling services. You would have virtual group meetings or workshops that are more convenient if somebody cannot go in and do group, like in-person programs, as well as printed materials that are provided through workshops or in-person interaction. And as I mentioned, newsletters through email and mail to provide the correct information to answer any questions that you may have or concerns.
So this one was not recorded, but I'll just do a voiceover. So for this audience, for the youth, middle school and high school students, we would like to do persuasion. This was selected because we need to educate the strengths and literacy on the risks of smoking. We would use group behavior therapy and counseling and support groups because we found out that having additional support and encouragement through these support groups helps encourage new behavior and stops old behavior. For policy, we'd like to have healthier, friendlier school environments, and that comes through the school resources of having officers, as well as promoting personal stories through written or video content on the associated risks to improve self-efficacy and to beat stigma and pressures that may be associated with wanting to smoke or wanting to try and fit in. Our communication channel would be face-to-face interactions through after-hours counseling workshops. This, again, is to provide support groups and the additional needs of what they would need to open up about their risks and their concerns or reasons for smoking. As I mentioned, social media is a huge influencer in youth lives due to social media and streaming services. So we would like to make ads that can go in television commercials or streaming services for Spotify or Premium. And they're non-skippable approaches, so they have to acknowledge the fact that they have watched the video, and this may help influence maybe a behavior change or a concern for one of them smoking and wanting to change behavior. The other platform is through TikTok videos, Instagram, and Twitter tweets. On to the partners and stakeholders.
So the key stakeholders for a rehabilitation program or smoking cessation program would be the American Lung Association, parents and loved ones, local health professionals and clinics, as well as your school resource officers from the Phoenix PD. The American Lung Association helps promote access, coverage, and research, as well as fund smoking cessation programs, and it helps target populations and associated risks. It educates to eliminate tobacco use by targeting marketing companies, as well as industry penalties for social media advertisements, and it targets trade measures. It supports rigorous enforcement of funding for these programs and is set by the regulations of the Food and Drug Administration. It also shows support for public right to know information and any disclosure regarding cigarettes or nicotine products. For loved ones, they provide emotional and social support that helps build trust. They construct the sense of knowing that somebody is there to help them get through the hard times and might be able to provide shared understanding and empathy. It also builds accountability and inspiration to keep moving along in this program and change behavior, as well as showing a reduction of feeling isolated. It provides valuable advice and lends a helping hand through constant reminders. For the local health professionals and the clinics, it helps raise awareness of harmful effects. It also highlights resource availability to the public and helps resources that may help them quit. And this can involve external or community-based resources and awareness of literacy. And the last key stakeholder on this slide is school resource officers. They help promote healthier school environments. They go in as safety enforcers, problem solvers, and as well as community resources and educators. This helps prevent smoking on school grounds. The last three stakeholders are the Phoenix smokers, advocacy groups, community coalition members. So this is anybody that might have smoked prior or can connect with smokers or the risks, and this is from advisory committee to strengthen community engagement. This could help engage adolescents and help them reach a healthier lifestyle without smoking cigarettes or trying cigarettes for the first time. It's also tailored to reach different culture groups among various populations or groups of people. It also reconstructs social norms and literacy and involves diverse organizations through research aid and media. It advances health, equity, and access and representation of cultural and behavioral risk factors and disparities that might exist within a community. It's also a charity funding option to put on events and webinars to improve literacy, and partnership and collaboration with nonprofit organizations to tailor the message among social media and streaming platforms. Insurance companies are important because they help provide the coverage for someone to be able to go to this therapy behavioral intervention, and it raises awareness of quitting as well as applying a surge charge to premiums. It can advocate for participation of these programs and help increase the success rate. The last stakeholder is Arizona Department of Health and Maricopa County Department of Health. This includes providing proper training programs for healthcare professionals in regard to the program and reaching the community needs to reduce disparities. It can improve collaboration with lending organizations and the development of social media messages, working with personal stories. It can also provide health communication through events to promote awareness and prevention, and it can implement policies and programs as well as improve access, awareness, and support to reduce smoking and provide modeling interventions. So the logic model template for my current smokers or high-risk individuals, as well as my secondary audience, would include the inputs. We need funding for the space and resources. We need partnership with psychologists and physicians to develop a personalized health plan. We need collaboration with the Department of Health within the state. We need staff for workshops, so we need trained professionals. We also need data and research studies for evidence to show that this program is working. And we need collaboration with insurance companies and a space at a local clinic. The activities would be to hand out questionnaires to households through email and mail, then enroll and train health experts on tobacco risks and behaviors to provide workshops as behavior smoking cessation programs. We develop tailored behavior interventions for individuals enrolled in a program and seeking help to then help share their personalized risks through counseling. We'd educate associated risks to peer support and provide engaged workshops for increased knowledge on proper aid. We collaborate with insurance companies to then develop expansion of coverage to improve enrollment. The outputs, as I mentioned earlier, I'm not going to read them over again, but it would be 35% of the Phoenix residents will complete the questionnaire. 5 local clinics will be developed among Phoenix, and we'll have trained physicians that can have support groups and education courses. We'd then 100 additional individuals to go through counseling and request participation on how to partake in the program. And we hope by 1/4 of the individuals out of the total Phoenix population to enroll in this program, and 10% will demonstrate success. 15% will then show a decrease in the overall rates and prevalence of COPD in former or current smokers. The initial outcomes, as I mentioned again, are from December 24th to December 26th. And this includes reporting awareness of smoking and knowing where to locate support groups and improving literacy, expanding insurance coverage to be able to partake in these programs, and increase literacy aid and support regarding healthier options compared to smoking, and then increase the amount of people who have stopped smoking, and improve their lung health, increase percentage of individuals who have reached the termination stage, and anybody that has not relapsed, as well as decreasing the number of mortalities among COPD cases within Phoenix. For my youth, same thing for the inputs, except we need tobacco use and research on risk among youth. We also need partnership with psychologists and physicians to prioritize their health plans on why they may smoke. Activities would then include provide and promote video ads for information, train health experts for workshops, provide counseling services free of cost after school programs, develop tailored behavior-based interventions to help enrollment of a program and help increase sharing of personal risks through counseling, educate associated risks and provide engaged workshops for increased knowledge of smoking risks, and collaborate with insurance companies to develop expansion of coverage. The outputs is to distribute and increase knowledge on nicotine usage and risks through storytelling and visual representation, provide educational workshops for counseling service for after-school programs, improve school policies for healthier environments, and have 75 students attend the program while 50 speak to counseling and services about their behavior choices and how to improve their health. The initial outcome is, again, from December 2024 to December 2026. This is to have 60% of the students within the Phoenix School District acknowledge the risks from watching stories, telling, as well as visual representation. By 2025 of June, we'd like to increase the number of students who have attended the counseling services and have done availability of counseling services and educational workshops among the Phoenix School Corporation, and increase the number of students who have reported that they've stopped smoking or have stayed away from smoking. And by 2026, improve health coverage for insurance plans. That way they can go to counseling and partake in these programs. I hope you enjoyed my presentation, and here are my resources. References, sorry.